Good day everyone, I am Kyle Abigail Comonal from BSN 111K. And for today, I am going to demonstrate how to give a PO. So, by mouth medication. So I am going to show you the administration of oral medication. Oral administration is the easiest, safest, and the most economical way for a patient to take medicine. And oral is the most common route for medications. And oral medications are usually in liquid, tablet, or capsule form. And now or today I am going to show you the oral administration of liquid medication. So it is in a liquid form. Okay, first thing to do is to check the doctor's order. Okay, now I'm checking the doctor's order. Okay, this is for me to see what medications I have to administer to the patient. Okay, the physician's order is acetaminophen 700 milligrams PO or by mouth as needed for pain. Okay, now that I have checked the doctor's order and now that I know the medications that I am going to administer to the patient, so now or next I must know the reason why the patient is receiving this medication or the medication. Okay, so actually I've already been in the room to see the patient and I have done all the appropriate assessments to the patient and he is complaining of stomach ache and he is requesting for a medication to alleviate the pain that he is feeling. And of course, after the assessments, I have given the information to the attending physician, to Dr. Villanueva. And that is the reason why the patient is receiving this medication, the acetaminophen, that is for his stomach ache to alleviate the pain that he is feeling in his stomach. Okay, now also I must check the medication administration record or the MAR. So what we are looking for here or what I am looking for here are the drug name, the dose, frequency, the route of administration, and the expiration date in administering the medication because orders for certain medications expire after a specified time frame and they need to be reordered by the primary care provider. Okay, now that I have checked the MAR, now that I know the drug name, which is acetaminophen with its brand name of Tylenol, and the dosage is 700 milligrams. Of course, the frequency is two times per day, and the route of administration per orum, so by mouth medication, and the expiration date. Okay, now that I've checked all of that in the MAR, now that I know about the medication, so next I'm going to verify the ability of the patient to take the medication orally. So I have to determine whether the patient can swallow, if he or she is in NPO, or is he nauseated or vomiting, has gastric suctions, or has diminished bowel sounds. Okay, now that I have verified that the patient can take the medication orally, so now I am good to go in performing hand washing, okay, and hand hygiene. Of course, that is to prevent and deter the spread of microorganisms. Okay, now that I have washed my hands properly and thoroughly, now or next is to organize the supplies. And the supplies are a medicine tray and a medicine cup. And I also have here a big tray of where I will be putting and arranging the supplies. Okay, I'm gonna organize now the supplies here because organization of supplies saves time and reduces the chance of error. Okay, now that I have organized the supplies, next I'm going to prepare for the medication na. And we have to bear in mind that in preparing the medications for one patient at a time. Okay, now I am going to obtain for the medication. Okay, now I am going to make sure that I have the right drug or the right medication. So I'm going to read the order on the MAR and compare it to the label on the medication container or on the unit dose package. Okay. Okay, so the information on the MAR and on the label are matched, so I have the right drug. So we are doing that, comparing the label on the order on the MAR. That is a safety check to ensure that the right medication is given. Okay, now that I have the correct drug and I have confirmed that, I'm going to check now for the expiration date of the medication. Okay, because we have to return expired medications to the pharmacy, especially if the hospital has a pharmacy. And of course, outdated medications are not safe to administer. Okay. Okay, now that I have checked the expiration date and we're still good in using this medication. Okay, next I'm going to check for the drug dosage. And I'm going to calculate for the drug dosage afterwards. Okay, so here it says the label dosage says 350 milligrams is 5 ml. Okay, now I'm gonna calculate for that because I have to administer 700 milligrams. Okay, 750 is 5 ml. I have to administer 700 milligrams. Okay, that would be 10 ml. Okay, now I'm gonna double check the calculation because 350 milligrams is 5 ml and they have to administer 700 milligrams. Okay, that is correct. I'm going to administer 10 ml or 700 milligrams. Okay, and now I'm gonna recheck the drug, the label on the medication with the MAR. Okay, again, this is the second safety check to reduce the chance of error. Okay. Okay, now that I have confirmed that, next in the preparation of the medication, I bet we're all familiar to this. We're gonna have to shake or mix the medication thoroughly before pouring it in the medicine cup. Okay. Gonna shake that thoroughly. Okay, now that I have mixed the medication, okay, now I'm good in opening the medication now so that I can pour it in the medicine cup, of course. Okay, and placing the removed cup like that, because we have to remember that the removed cup must be placed upside down on the countertop because that avoids contaminating the inside of the cup. As you can see, the inside of the cup is pointing upward so that it won't get contaminated on the surface area. Okay. Okay, now that I've opened the bottle, the medication, okay, now in pouring the medication, we must remember that we have to hold the bottle with the label is next to our palm. So, like this, we have the label here, the name. So I'm gonna place that next to my palm. So I'm gonna hold that like that as I pour it later, because we have to pour, or I have to pour the medication away from the label. That is to prevent the label from becoming soiled and illegible as a result of spilled liquids, of course. Okay, and also we have to position the medicine cup, or we're gonna place the medicine cup on a flat surface at eye level and with the bottom of the meniscus, which is the crescent-shaped upper surface of a column of a liquid, to align with the container scale, because that method ensures the accuracy of measurement. Okay, now I'm gonna place the medicine cup here on the flat surface at eye level. Okay, as you can see, so now I am good to go in pouring the prescribed amount of medication on the medicine cup. So I'm gonna put this aside first. Okay, and I have already calculated earlier 700 milligrams is equals to 10 ml. So I'm gonna pour the medicine until it reaches the 10 ml line. Okay, so I'm gonna hold the bottle now with the label next to my palm. Okay. Okay, 10 ml. Okay, now that I have poured the prescribed or right amount of the medication into the medicine cup, so now before cupping the medication bottle, I must wipe the lip of the bottle so that it prevents the cup from sticking. Okay, I'm gonna discard this into the proper receptacle. And now I am good to go in to administer the prepared medication to my patient. Okay, now I am good to go to administer the prepared medication to the patient. Of course, still performing the introductory steps where I greet and introduce myself to the patient. That is to build rapport and gain the trust and respect of the patient. And verify the patient's identity. That is to ensure that the right patient receives the medication or the right medication. Ensure patient's privacy and explain the purpose of the administration and how it will help him or her. Okay, so now I'm gonna put this here in the tray. I'm gonna get the MAR, of course. And I'm gonna return this and I'm gonna have the label that I have opened it. Okay. So now I'm gonna head to see the patient and administer the prepared medication.
Come in.
Okay, good afternoon, sir. I am CPC-Comonal, your student nurse for today.
Good afternoon.
Okay, just wait a second, sir. I'll just make sure that the door is closed, okay, for your privacy. Okay, sir, may I see your wristband, please? Okay, thank you very much. Please state your complete name.
Roberto Zaragoza Comunal.
Okay, and your birthday.
August 23, 1966.
Okay, thank you very much, Mr. Comonal. So, sir, I'm back here. I know we've met earlier during your assessment. So, I've been sent here by your attending physician, Dr. Villanueva. I'm actually here with me his prescribed medication. So, I have here your medicine. This is actually a liquid medicine, so you're gonna have to take this orally. Okay, so this is for your stomach ache. This is to alleviate the pain that you are feeling with your stomach. Okay, sir, this is actually called the acetaminophen. Okay, so I'm gonna administer 700 milligrams, so that is 10 ml. And sir, this medicine, the acetaminophen, this is actually used to relieve mild to moderate pain such as headaches and the stomach aches that you have right now. Okay, and this acetaminophen medicine, sir, is in the class of medications called analgesics, which are the pain relievers, and antipyretics, which is fever reducers. So it works by changing the body senses pain and in cooling the body. Okay. Okay, now I'm gonna assist the patient to a sitting position because that position facilitates swallowing and prevents aspiration. Okay, sir, I'm gonna assist you now in sitting. Okay. Okay. Thank you very much. Okay, now in administering the medication, we're gonna have to give the patient sufficient water or prefer juice in swallowing the medicine. Okay, so I'm gonna have to ask the patient which one he prefers. Okay, sir, do you prefer water or juice with your medicine or in taking your medicine?
Just water.
Okay, so just water. Okay, sir, I have here the acetaminophen. It is 10 ml and your water. Okay, just drink that now. Okay, we have to stay with the patient until all the medications or until the medication have been swallowed, because that is for us student nurses or nurses, because we must see the patient swallow the medication before the drug administration can be recorded. Okay, sir, now you can lay back. Okay. Okay, sir, now that I've administered your medication and now that you have taken your medication, so now I'm gonna head out, okay? So do you need anything?
No more.
Okay, so thank you very much for your cooperation. So, sir, don't hesitate to call me if you need anything. Just push the call button there, the signal device, okay? Okay, and after the administration of the medication, of course, I'm gonna have to document the medication that I've just given to the patient. Okay, that includes the drug name, the type of medication, and the dosage, the route of administration, and the time. And if there's any complaints, also I'm gonna have to document that. And if the patient or the client refuses the medication or omitted the medication, so I have to document that as well, and I have to let the patient sign as the proof of his refusal of the medication. And lastly, we must never forget to affix our signature to the documentation sheet, because that signifies that we have carried out the doctor's order. Okay, and afterwards, of course, I'm gonna perform the aftercare of the equipment. So I'm gonna clean or wash the supplies or the equipment if needed, and I'm gonna discard the disposable supplies, such as the disposable medicine cup that I've used earlier. So I'm gonna discard that, and I'm gonna have to return the cart to the appropriate place. And that is for my oral medication administration.